Everyone, Ronnie from IKN. So what we want to do in this video is walk you through our thought process with our treatment framework. And now we have to keep in mind that this is the treatment framework, but we do have a separate assessment framework that we'll touch on briefly here as well. Now, this framework is really put together to help people navigate the complexity of the body, especially when we're working with somebody in front of us who's currently experiencing pain, and really help us with how we are sequencing the delivery of our load during treatment. Because for us at IKN, the sequencing and the strategies underpinning the delivery of our load is much more important than just constantly chasing fancy techniques for short-term change. Okay, and so there's a few important points that we just need to briefly consider when we're working with anybody who is currently experiencing pain, and just before we move through the rest of this video. And one is that pain is oftentimes just a reflection that the higher parts of the brain have determined that your system needs more help, it needs more protection to handle stress or handle load. That's number one. Secondly, we have to recognize that our system is always under stress through many different sources, but the most common sources of stress are gravity and respiration. Simply put, stress is anything that puts pressure on our system or requires a response which takes energy. So for example, the reason why breathing stresses our system is because the constant loading, or there's this constant loading of tissues around the ribcage through the movement of air that's always feeding back information to the brain that has to be processed, and that takes energy, as well as the fact that the act of breathing creates an internal perturbation as we move. So it almost acts as a constraint to our movement through the movement of air into our system that creates a constant movement at the ribcage. So again, that's not a bad thing, it's just something that we need to consider and recognize as a constant source of load. And so it's very important for us to consider with any kind of pain experience. So when you look at the complexity of our body, of our movement system, as well as a lot of the movement research, which really aims to understand this complexity, you'll find that the majority of the research really focuses most of its time on trying to understand the complexity of the limbs. The limbs are the body segments that obviously allow us to directly interact with our environment. They have a very specialized morphological arrangement where we see a lot of complexity at the distal endpoint, the hand and at the foot. And then as we move proximally, we see these much longer bones that lack segmentation. Right? And this allows the limbs to be able to take advantage of specific tissues to dampen stress and dissipate stress before it reaches our midline, which is a very complex and adaptable region. We want it to stay adaptable. And that's something that's really important to our treatment approach at IKN. So the initial component of our treatment framework really involves improving this capacity of the limbs to handle stress and dissipate stress well on their own, without any increased workload at the midline. Okay, and that's what we refer to as the client's dissociation capacity, using these global dissociation strategies. Now, this doesn't mean we're just stretching the limbs, but it actually means we're stepping back and we're taking advantage of the specific neuroanatomical features of the limb compared to the midline. We view this as a very important first step to treatment, because this capacity is very important to support the ability of our system as a whole to handle stress. Okay, and with this global strategy too, we place an awful lot of emphasis on the breath coordination of the client. So looking at inhalation versus exhalation strategies. Can they breathe well while we load the limbs? All right. So let's use a case example. Let's say we have a client with persistent right-sided neck pain that came on gradually with no clear mechanism of injury. Let's say they had a shoulder injury on the same side many years prior to experiencing this neck pain. Now, at IKN, we always want to view midline pain experiences, like the neck, within the context of the rest of the midline and the rest of the associated limb. So how are the neck tissues cooperating with other systems and other tissues around the head and neck, as well as the tissues around the ribcage? Again, we also want to view the neck within the context of the associated limb, the upper limb in this case. Right, and with that, we have to recognize the features that allow the limb to move and handle stress in the real world. And so we could narrow our focus on the neck initially, or we could widen our focus first. Right, and so if you look at the upper limb and the neck as a gradient, right, that runs a control gradient that runs from the hand proximally towards the midline. ask yourself what region or what segment of that gradient should be more sensitive to load with real-world movements, or what tissues are in more direct contact with the environment. And it's a clear answer. It's the distal part of the limb, it's the hand. Okay? Does the neck have to experience direct load on an everyday basis? Ask yourself. It's very rare that it has to do so, unless you take part in any kind of specific sport, but on a day-to-day basis, on a moment-to-moment basis, it really doesn't. So a big part of our rehab involves restoring that loading gradient, or that control gradient, or that load sensitivity to load insensitivity gradient. Okay? Because what if the neck is expressing more tension or more pain because the nervous system has determined that the limb doesn't express the capacity to handle stress and load being distributed from distal to proximal? So that's a very important protective feature for our system to be able to express. And even going deeper, we could even consider how the prior shoulder injury may have disrupted the capacity of the upper limb to handle that stress and load well, especially if it wasn't treated or rehab properly. Okay? So once the client has expressed the capacity to dissociate their limb using specific loading strategies, and of course we would assess this capacity first during the assessment process, then we want to move on to more directional loading strategies. Okay? Now, the key thing to understand here is that the movement of our limbs is directional in nature. It's vector driven. So when we move, the brain doesn't individually activate isolated muscles to move us towards a target of interest, but we typically have a target that we're moving towards. So we set an intention to move towards that target, okay? And the tissues that allow you to move towards that target take on more of a self-regulatory role to maintain the trajectory of the distal endpoint. So when I'm moving to reach something with my hand, for example, the tissues proximal to that will take on more of a self-regulatory role to maintain the trajectory of the hand on the target. Now, the reason we try to place more focus on these capacities first before narrowing our focus on the neck is because, and again we alluded to this just a few moments ago, is often because these local pain experiences are expressions of top-down protection, because our brain has determined that our system can handle forces or loads well. So if we spend all our time working on the neck but not restoring the client's ability to handle forces and recognizing the features that allow them to handle forces well, then we might not see any long-term change. Okay? So most importantly, our initial goal with any kind of rehab is to provide proof of protection to the brain. And proof of protection, from our perspective, comes from improving the person's capacity to handle force as well, not just stretching muscles and opening up range of motion around the neck in this case. And this is a big reason why those feedback-focused strategies that you see on the right-hand side there are left a little later throughout the treatment process, but they're still very, very important. But for us, the sequence of the input, the sequence of the load is key. So the first way that we want to orientate these directional loading strategies for the limbs is through an overcoming lens. Now, we dive into some research surrounding overcoming versus yielding strategies as they pertain to isometric contractions within our courses. But with these overcoming strategies, they tend to be more driven towards more consciously driven neurological strategies. They bias more conscious-driven neurological strategies to experiencing load. Okay, and this is important because from the beginning of rehab to the end, we want to move from a conscious to a subconscious movement strategy. And biasing more of an overcoming focus initially when loading the system allows us to work with what you see here, these force estimation qualities, which really targets how well a client can express the appropriate amount of force to complete a task. Because oftentimes in clients who are experiencing pain, their muscle contractions are very noisy. They can't produce the appropriate amount of force to respond to stress. And it's not all about weakness versus strength. It's not that strength is good and weakness is bad. It's never that easy. It's not that simple. But it's about expressing the most appropriate amount of force for the task at hand. And this really comes down to being more energy efficient with our movement. Okay, so that's something we put an awful lot of emphasis on. Now, the actual application of force depends on the directions of movement that the client has more difficulty with. And that's something that we have to identify during the assessment process, right? Using very, very simple assessment strategies. But once we can allow the client to express these dissociation and overcoming strategies, which might take 5 to 10 minutes to work through, then we can revisit these local or more feedback-focused limiting factors that we found earlier during our assessment. So are they lacking range of motion at the neck? Are they breathing well and expressing good quality movement at the rib cage, for example? And the key with these feedback-focused strategies is that they are, or what we like to do is we like to merge them with the dissociation and directional loading strategies that we've done previously. So we're always working on improving the capacity of the client to manage forces well, but also considering these unique local limiting factors too, just doing both together. So we might have to integrate some local loading around the neck of the rib cage, or we might have to be more specific with the orientation of the neck or the head and the rib cage during these dissociation and overcoming strategies. Okay? Because oftentimes these specific local feedback-focused strategies may not be needed. We have to consider that too, especially if all the nervous system needs is an experience of load through the upper limb, and to experience that the upper limb has the capacity to handle those stressors, handle those loads, so it could feel more comfortable and reduce the pain experience of the neck. So we're really creating an environment that reduces the need for protection. We're reducing the value that pain has from a neurological standpoint. Okay? So moving to more global yielding-based strategies. Right, now if we still continue to consider the neck here, the neck pain case example, at this layer we're increasing the load and the force sharing quality of the upper limb here. Right, now our ultimate goal with rehab is to improve the distal, the proximal load tolerance of the limbs, so that the midline tissues can maintain adaptability and don't require pain as any kind of protective response. Now, yielding strategies with the research, they're more akin to more eccentric contractions and more subconsciously driven controlled strategies. But the manner in which we load the limb is going to be more isometric in nature from a rehab standpoint and restoring that cooperation and coordination amongst tissues. We want to improve that force sharing capacity, the capacity of tissues to dissipate stress while the neck stays adaptable, because it's part of the midline. And at this layer, we can also merge local and feedback focused strategies too of the neck with the limb loading too. But again, the key point here is that the local features typically present more of a form of protection, but the solution likely isn't local work to release those local restrictions, for example. So for us, a large part of the solution is restoring these movement features of our system to help handle stress. And then, if necessary, we're going to merge those local factors, those feedback-focused strategies, based on the unique needs analysis during the assessment with those more global strategies. So we're merging global strategies and local strategies, but it's the sequence that we're doing it throughout the treatment process that's important. Okay, so once the client expresses these capacities, we can then move into more coordinated strategies, which involve more dynamic loading of tissues and really integrating the limb and the midline together in a manner that mimics their interaction with real-world movement. Okay, now throughout this whole process, the goal is to obviously reduce the necessity of pain and not just focus on reducing symptoms. Okay, and this framework really helps us to navigate the complexity of our movement, and especially movement that accompanies pain. It's not just a case of getting the local stuff to move better first and then move on to the global stuff, because oftentimes the local restrictions are present because we're not expressing these global features well to manage forces and loads well. Okay, so that's a really critical insight there. So that's a very brief insight into this treatment framework and our thought process when working with people in pain. And of course, it needs to be context dependent, and we need to consider the unique factors connected to the unique individual in front of us. But for us, we have to recognize that we all possess these neurological and anatomical movement features that help us manage forces and loads always that are acting on our system. Okay, and if we can merge those within our treatment, we feel as though that we can facilitate much more robust change instead of always narrowing our focus too soon. Now, of course, we have many loading strategies and treatment strategies that we teach on our courses, as well as many assessment strategies too. So if you'd like to learn more about those, be sure to check out one of our IKN courses.